Hello everyone, I'm Scott Gregg. Look at almost any dentist website these days, and two things you're going to hear a lot about are veneers and bonding. There are two types of cosmetic dentistry that have become very popular among people. So we decided to ask a local dentist about veneers and bonding. What exactly are veneers and bonding, and what are some of the differences? Dr. Patrick Quacha, the Dream Dental Group in West Bloomfield, Michigan and Commerce Township is joining us to discuss veneers and bonding.
Bonding is the use of composite resin, so it's basically white filling material, to correct imperfections or deficits in one's cosmetic appearance of their teeth, basically. So let's say you have a chipped tooth, you cracked a tooth in half, or you just have a little bit of spacing that you don't really like, you don't want to go through braces, and perhaps your budget doesn't afford for porcelain veneers, which is kind of the next step up. What you can do is directly apply an adhesive, match the color of the composite, and then bond and hand shape that composite right into those spaces or right onto that chip. You shape it, you cure it, it immediately sticks and bonds to the tooth. We shape and polish it right in the office. You walk out of the office in an hour, poof, your teeth look good.
So basically what you're saying, if I'm hearing you right, is that bonding is a very cost-effective way to improve your smile very quickly.
It's a very, very cost-effective way to improve your smile significantly, and again, very, very quickly. I actually have bonding myself on all my teeth in the front. I used to have a very large gap between my two front teeth, and now it's gone. And that was through the use of bonding. It was done in under an hour, and it's lasted about 7 years so far, and it still looks good.
Okay, Dr. Quacha, so compare and contrast bonding and porcelain veneers then. Give us a little bit of the pros and cons of each.
Bonding can last a long time, but when you compare it to porcelain, it is not as durable of a material. So both have their pros and cons. Porcelain you're going to pay more for, but that is a hard, fired, ceramic that's glazed, so it doesn't absorb stain very well, doesn't chip very easily, and it maintains its look for many, many more years than bonding. However, bonding is significantly less expensive and still looks good for, I would say you can at least get 5 to 7 years out of it, depending on the situation and depending on your habits and whatnot. But bonding will stain faster, it can chip easier, it does kind of wash away sometimes over time, but conversely, one of the benefits of bonding is that you can repair it, refinish it, and reseal it. So if you chip something that has bonding on it, you can just repair the little chip and move on with your day, where if you chip a porcelain restoration like a veneer, that has to be completely replaced.
Dr. Patrick Quacha, the Dream Dental Group in West Bloomfield and Commerce Township, Michigan, thanks for joining us today. Fascinating discussion on whether you would want a veneer or whether you would want bonding. I'm Scott Gregg. Thanks for joining us.